Congressman Jamie Raskin of Maryland was appointed to the panel and joins us live tonight. Congressman, thanks so much for joining us.
I'm delighted to be with you, Shawn.
Let me ask you, what grade would you give the Trump administration's response so far to this crisis? What have they done right and what have they gotten wrong?
Well, yeah, I guess ever since I left academia, I'm not in the grading business. So here's the major problem. We don't have a plan. I waited with bated breath when the president said he was going to release his plan, but the plan were just some criteria that states should consider when reopening. There was nothing about the federal role, nothing about the federal government mobilizing the industrial sector to produce the testing equipment we need, the PPEs, the ventilators, and then coordinating a federal-state approach where we're all on the same page. And so I'm afraid what we've got now is very helter-skelter. It's all over the map. You know, West Virginia starts to reopen. Another state is closing down. It's the worst day of all in D.C. We don't have a regional, much less a national strategy to get us all on the same page to get out of this nightmare.
You mentioned the administration has been criticized for not mobilizing industry to create some of those PPEs, not having enough COVID-19 tests, and not having a plan. What should the administration be doing?
Well, the Reopen America Act, which I introduced with Congresswoman Donna Shalala, who was the Secretary of HHS, lays out a plan that is science-based. What science tells us is that a state's ready to reopen when two conditions are met. One is that the hospital can meet the demand without being overwhelmed and in crisis. So when the hospital system is working. And two, when the infection or transmission rate is headed down, which means that each person who's got the disease is infecting one or fewer people, hopefully nobody. But then you've got the infection, you got the virus on the run, and the infection rate is going down. If people are infecting more than one, like 1.2, 1.8, or I think we've been around 2.1, that's when you get pandemic conditions where the disease is out of control. So once the states bring it under control, the trend lines are in the correct direction for 14 days, which the president's plan does get right. At that point, the state should be able to apply to the Secretary of Health and Human Services for approval of a reopening plan that's based on mass public testing, vigilant contact tracing for anybody who's got it to find out who they've been with in the last 2 weeks, and then treatment and quarantine for people who've got it, and then rigid public health protocols that are suited to each different social context. So what is necessary for K through 12 or even K through 6 is different from what's for 6 through 12, for college and university, for the workplace, for commerce, for restaurants, for social life. Then we lay out a whole bunch of criteria. And when a state gives us criteria that make sense, HHS approves it and the federal government will pay for it. Right now, the federal government has pitted the states against each other in this brutal competition for PPEs and for ventilators. And that's not going to work. That's like Articles of Confederation stuff before we had a constitution where it was every state for itself, you know.
Congressman, I apologize. We are out of time. I do want to ask you just one quick question. Your brief response, if you could, to criticism that this is a partisan committee meant to point the finger and sort of be impeachment 2.0 against the president.
I mean, we're so far beyond that stuff. We've lost 60,000 Americans. We've lost more people than we lost in the Vietnam War. We've got more than 1 million cases. And anybody who's talking about partisanship is injecting partisanship. Let's get beyond that. We need an oversight committee to make sure that the government is bringing the country together. We're all moving together to spend the people's money in an efficient and effective way.
Congressman Jamie Raskin, thanks so much for joining us. We appreciate it.
Thank you for having me.